Something you may not realize. Do you realize that a healthy premenopausal woman, they have 15 to 20-fold higher testosterone levels than they even do estradiol? It is quite a woman's hormone too. They don't need as much as men.
Yes, sir.
But it is their most abundant gonadal hormone. Now, we've talked about this many times. Men can hardly get treatment. Now, imagine women.
Right. The problem is that doctors are very badly educated.
That's it.
We're not educated in this at all. Not at all. Not at all.
They're very, very badly educated. It's just a general observation from a lay person. I guess you could consider me a lay person. Doctors are trained. They're not educated.
That is correct.
That's a problem. That is a problem.
And when you consider that the medical schools are funded by the pharmaceutical industry, of course they're going to heavily influence what gets taught to these young physicians that are going to come out and prescribe their products.
When you consider that the FDA is funded by the pharmaceutical industry.
That's correct.
That's kind of a problem too, isn't it?
Mm-hmm.
We've got lots of problems, and I don't know that there is a systemic solution to this, but I do know that there are offices such as yours that are approaching this correctly, and the bottom line here is that you, the patient, need to take responsibility for these.